This video will lead you through the remaining steps required to place an ultrasound-guided triple-lumen catheter in the internal jugular vein. We start where the sterile technique video left off. You have already consented and sterilely prepared your patient for the procedure. Before proceeding further, you should perform a timeout. You and another individual should identify the procedure being performed, site of planned procedure, and the patient the procedure is being performed upon. Let's review the materials included in the central line kit. You may find it helpful to lay everything out in the order you will be using it before starting. You'll need lidocaine for numbing the insertion site. Draw up the lidocaine using the filtered, large bore needle. Recap and switch to the smaller bore needle. Stick it in the sharps holder for later use. Next, you'll need a larger bore needle and syringe, which you will use to cannulate the vein. Then the guide wire. Make sure it slides easily in and out, and that the curved end is retracted. Now the scalpel and the dilator. You'll next need the catheter, which, as mentioned previously, is not included in the kit. Have your assistant drop the central line onto your field, as well as some sterile flushes and line caps. You'll note that each of the 3 lumens of the central line have different colors on their ends. The brown tip lumen will be the lumen your guide wire will come through. Apply caps to the lumens and flush them with water. Clamp the other 2 lumens, but make sure you leave the brown lumen unclamped and uncapped. Finally, you'll need thread, along with the needle holder. You should have already identified where you plan upon inserting your catheter before sterile preparation, but let's reconfirm the location. Pick up your now sterile ultrasound probe and using the sterile gel, locate the internal jugular vein. Next, create a wheel of lidocaine at the insertion site, which should be just cephalad of your probe. Then, using the larger needle and syringe, attempt to cannulate the vein. Remember that your needle should be at a 45-degree angle and directed at the ipsilateral nipple. The tip of the needle will appear bright white, while the rest of the needle will appear as a shadow when it is transected by the plane of the ultrasound probe. The entire time you are advancing the needle forward, you should be applying continuous negative pressure by gently pulling back on the syringe. When you enter your vein, you will get a flash of blood. Stop advancing the needle at that point. Now remove the syringe, carefully stabilizing the needle with the other hand. Pick up the guide wire and thread it through the needle opening. It should advance easily. Notice there are markings on the wire. Advance it to the 3 stripes, or 30 centimeters. Free the remaining guide wire from its holder. It is important that 1. You ensure that the free end of the guide wire doesn't flop off the sterile field, and 2. You never let go of the wire. This is to prevent the guide wire from advancing further into the patient than desired. You or your assistant should be paying attention to the patient's telemetry as you're inserting the guide wire. If the patient begins to have an increase in PVCs or develops an arrhythmia, the wire may be too far in and need to be withdrawn. Remove the needle and place it in the sharps holder. To confirm the position of the guide wire, pick up the probe, orient it longitudinally, and visualize the wire entering and traveling through the vein. Next, you are going to widen the track for easy insertion of the central line. First, pick up the scalpel and blade facing away from the wire, slide it along the wire and insert it several centimeters into the patient's neck, deeper for patients with thicker necks. Then, slide the dilator along the guide wire. Applying pressure from the portion of the dilator closest to the neck, advance it several centimeters into the neck, and then remove. If there's oozing, gauze may be needed. Note that some people prefer to place the dilator onto the wire first before creating the nick with the scalpel. Now pick up your triple lumen catheter and advance it along the guide wire into the widened tract you have created. How large the patient is or how thick their neck is will determine how far you insert the catheter. You ideally want it sitting at the junction of the SVC and the right atrium, around 16 centimeters in the average patient. You may find that as you advance the catheter over the wire, you'll actually need to withdraw the wire several centimeters until it extends out the brown catheter lumen before inserting the catheter fully into the neck. Once appropriately positioned, withdraw the guide wire fully. Now you will need to flush all of the lumens and apply a cap to the brown lumen. To appropriately flush the lumens, attach a syringe and hold it vertically and withdraw all the air from the lumen until a small amount of blood actually enters the lumen. Holding the syringe vertically will allow the air bubble to rise to the top of the syringe. Then flush the lumen until the blood is cleared, being careful not to re-inject air into the lumen. Reclamp and repeat. Now suture the catheter into place. Once sutured into place, a sterile dressing should be applied over the catheter. A chest X-ray should be obtained to both confirm positioning as well as to rule out complications such as pneumothorax. Additionally, a procedure note should be written in Medivision. We have now seen how to successfully place a central venous catheter using ultrasound guidance and sterile technique. We hope you have found this video helpful.